Hi there, welcome. My name is Cassandra Cannon. I'm a licensed clinical psychologist, and I'm also an APA approved sponsor to provide continuing education. And I just released a telehealth course on the efficacy, laws, and ethics of using telehealth to treat clients. And so if you are coming up on your licensure renewal and you need a few more continuing education courses to fit under those laws and ethics sections, I hope you consider this course. It's 2 hours and it's self-paced. And one thing that we cover is informed consent and the importance of having a separate informed consent document, especially if you're in a state that requires it. But also it's clean to have that separate informed consent document specifically for telehealth. And like many people, when I made the switch over to telehealth during the pandemic, I was really anxious in trying to make sure I got everything squared away that needed to happen legally and ethically to provide telehealth treatment. And informed consent is one of those important documents that you need to have ready for your to review with your clients and to have them sign off. And I do have a free digital download. It's a checklist that I'm going to kind of base this video off of. You can go to my website at www.canonpsychology.com, click on Therapist Tools. It'll take you over to Thinkific, and an option of a free digital download is the telehealth-informed consent checklist. So obviously, you need to have your provider and client information on this informed consent document, the nature of the services that you're offering over this platform, and any limitations compared with in-person care. So, for example, if you are a treatment provider that also does psychological assessments, and when I say assessment, like not like an interview, but actual MMPI, Rorschach, those types of psychological assessments, what are the limitations of that? Some of them really need to be done in person. We don't have a way to really effectively administer, and others are just fine online. My sister's a school psychologist, so she's doing this all day long of what's best in person and what's online. You need to discuss with your clients the potential risks of telehealth, and the biggest ones are privacy and confidentiality breaches. And that would be them maybe not having the best privacy in their home, or possible breaches when it comes to just that digital information that's being, sent for us to have this video session. But a lot of people really feel like the benefits really outweigh the risks. And obviously, I think we can think of a few benefits off the top of our heads. No traffic. If someone's coming down with something, or I'm coming down with something, or I'm getting over something, I'm not worried about exposing someone or being exposed. I cannot tell you how many sessions I think in person I would have preferred the client cancel versus, I don't care, just come. You're feeling well enough, you're not going to make me sick. Something that really needs to be in your informed consent document is the how you handle confidentiality and data security, and that's not only for your electronic health platform, and what I mean by that is your medical record, but also what platform you're using. So some people use Zoom, which depending on the version, Zoom will sign a business associate agreement. So that version would be considered okay HIPAA-wise. The one without the business associate agreement is not. That is risky. Some people use DoxyMe. I use a special one for EMDR that allows you to do eye movements via the software on the screen. So I have in my informed consent document the specific platform I use, along with their security and encryption standards. And it's also important to kind of explain how the records in your data are stored, and also how you destroy things. And I actually have a separate data security management download too that walks you through the appropriate ways to destroy your data, whether it's software or hardware, along with different ways to safeguard privacy in general, too. Other aspects of your informed consent document need to be emergency and crisis protocols. I do recommend that you have that address of your client and you make sure you know where they are each time. Most clients are going to be in the same spot and you have that address, but if someone's at their home office one day or their work office another day, you need to know those addresses so that you can call if there's a medical emergency. But also, I think the biggest one is technological disruptions and it doesn't happen very often for me. Sometimes my internet will freeze or their internet will freeze, and most clients, we just keep going. It doesn't bother them at all. Some clients, even if they might have some abandonment stuff going on, I started saying, "I always come back." And they laugh like, "Yeah, you do. You always come back. We always come back. We always figure it out." That can be used just as you can use it as a therapeutic tool. I always come back, here I am. It's also important to discuss, okay, so if there's a power outage, like in mine, I have this is our plan A, these are our other options. Ultimately, we can do a phone call. Most people are just fine with that. Some people don't want that. Well, then we discuss, do we reschedule and what that looks like as well. Also, really, really important, I have a whole separate video on this, is the importance of your client being physically located where you are licensed to treat. I know that can be really difficult and really tempting if you've treated someone for 2 years and you're making great progress and they move to another state, and it can be tempting to change it to coaching or consultation. Not recommended, it's not honest, and that state could reach out to your state board and say, "So-and-so is practicing in the state of XYZ without a license." So keep that in mind. Don't forget, many states will allow you to continue to treat your client for a period of time. They might allow you a temporary permit. You reach out to them and find out. Actually, most of the time they'll have all that information on their website, on the board website. Find that out, get that temporary permit, do what you need to do, but be very careful about client physical location when you're providing treatment via telehealth. And they need to know that they don't don't show up to a session and, "Oh, yeah, no, I'm out of town." I have that conversation with them within our first session, so we know we need to make plans around what to do if you are gonna go out of town. You also, in your informed consent, need to discuss how you communicate between sessions, and that would be in your regular informed consent too. And you, of course, need to then just have that signature and acknowledgement and have that all signed and in your medical record with your client. So I hope that this little walkthrough was helpful. I do recommend that you get my checklist. There's also other forms that you can find that might be also helpful. But I hope this was helpful, and I also hope that if you feel like you'd like to know a little bit more about the general research about telehealth and how that's panning out, and the different laws and ethics around providing treatment on the telehealth platform, that you enroll and attend my CE course on telehealth, efficacy, laws, and ethics. Thank you.